What do you know about antibiotic resistance?
Well, what are antibiotics?
An antibiotic is the medicine that fights bacteria that can make you sick.
Then what does antibiotic resistance mean?
It might be helpful to think of bacteria as tiny invaders. So when we use antibiotics too much or if we use them incorrectly, some of those invaders or bacteria learn how to survive the medicine. From there, they teach other bacteria how to survive.
So the medicine stops working?
It can. Providers might have a harder time finding medicine to help people get better.
Good to know.
Why can't doctors just prescribe antibiotics for everything?
It's because antibiotics will only work against bacteria. It doesn't work with viral infections like the flu or like a cold. A lot of people think antibiotics are a quick fix, but using them when they aren't needed makes this bacteria grow stronger over time.
How does that happen?
So bacteria can reproduce really fast. If some bacteria were to survive an antibiotic treatment, those surviving bacteria then multiply and pass along their resistant traits. Over time, the antibiotic becomes less effective.
So people misusing antibiotics affects everyone.
Yeah, you got it. Antibiotic resistance is a public health issue. Resistant bacteria is able to spread between communities, hospitals, and even within the environment, potentially affecting you or me.
That sounds scary.
It is. This is why antibiotic stewardship is so important. That means using antibiotics responsibly. Thanks for your attention today.
Hi, my name is Hannah, and I'm a graduate student at the University of St. Thomas doing my master's in electrical engineering.
That's so awesome. And have you been on any antibiotics recently?
I've been on antibiotics 3 years ago when I had a huge fever.
Okay, yeah. So antibiotic resistance is a big topic right now. Antibiotics are commonly prescribed, but a lot of people don't realize bacteria can actually adapt to them over time.
So it can actually become immune to antibiotics?
Correct. So a lot of it comes from misuse or overuse, things like taking antibiotics for viral infections, not finishing the prescriptions, or using the leftover antibiotics and giving them to other people or saving them for later, all lead to this. So this is what kind of makes it a broad public health issue. Resistant bacteria can spread between people, spread between communities, and it doesn't just stay within one person.
So what precautions can we take, or how can you prevent this?
Yeah, that's a great question. So the biggest steps are pretty simple, honestly. Only taking antibiotics when prescribed is essential. Also finishing the full prescription regardless of how you feel, and never share antibiotics. And do not pressure your healthcare providers for them when they're not necessary.
So even if the antibiotic did its effect and I'm feeling better, I have to keep on taking it for the prescribed duration?
Always, yes. That's a great question, and I'm really glad that we had this conversation today. Thank you,
Thank
Hannah.
Hello, my name is Randy Nelson. I am a physician assistant, and for over 2 decades I've worked in interventional pain management.
So from your perspective in healthcare, how serious do you think antibiotic resistance has become?
It has become a very serious issue. When healthcare providers diagnose and treat patients, we differentiate between a viral infection and a bacterial infection.
Okay.
Well, some patients, they don't want to leave the clinic without a prescription for an antibiotic.
Right.
Even when the healthcare provider believes it's a virus, which typically will go away on its own in 7 to 10 days.
So do you think people outside of healthcare even have a true understanding of how important antibiotic stewardship is?
Wish that they would know, because there's different regions of the United States. When we lean on the big guns like vancomycin,
Right.
And penicillin, there's more and more resistance because of the overprescribing.
Mm-hmm.
And then a lot of patients don't finish the regimen.
Mm-hmm.
They feel good, so then they don't finish it, and they save it in the refrigerator for later. Whenever I've prescribed an antibiotic, I would tell the patient, you have to take it from beginning to end, even though you're feeling good, because you want to wipe out that strain of bacteria.
So do you think discovering new antibiotics is keeping up with resistance currently?
No. Globally, you can read globally where there's antibiotic resistance and they keep going up and up and up the ladder, but unfortunately we're running out of viable options.
Right.
There's a whole bunch of different classes of antibiotics. I just think that it's been abused over the decades, and we in healthcare, that's why we really just want to give patients comfort by telling them, hey, I honestly believe that you have a viral infection that will go away on its own. You can take over-the-counter medications to help with the symptoms, but indeed it will go away.
Right. Well, thank you so much.